So now we are going to look at another one is the hiatal hernia repair. Which structure is at risk of the damage? It is vagus nerve is at risk of the damage during repair of hiatal hernia. So as you can see here in this picture, this is hiatal hernia in which upward extrusion of stomach, part of stomach through weak part of diaphragm. That condition is known as hiatal hernia. When in normally stomach is located below the diaphragm, and when in hiatal hernia there is protrusion of mass of stomach upward from the diaphragm, that is known as hiatal hernia. Okay, so the next question is congenital lower motor neuron lesion in the facial nerve is common because it is birth defect. Facial nerve lesion which is congenitally it is common because of birth defect. Old man with generalized body edema is caused because of hypoproteinemia and albumin deficiency results in edema. A lady cuts her finger and with a knife working in the kitchen, which mechanism vasomotor response increase? That is postganglionic C fibers. Postganglionic C fibers increase vasomotor nerve effect. Okay, so normally there is autonomic nervous system is made up of preganglionic and postganglionic neurons. Preganglion, as the word pre includes cell body in the brain and spinal cord. Postganglion is cell body lies outside CNS and autonomous ganglion. Now, preganglionic fibers are myelinated type B fibers and postganglionic are unmyelinated type C fibers. These terminate into autonomic ganglion and these postganglion fibers terminate in visceral ganglion. So in this way, this is the difference between preganglion and postganglionic nerve fiber. Okay, so the next one is the patient present with bilateral ptosis, muscle wasting, muscle of mastication wasting, decreased voice with no uttering. Diagnosis is myasthenia gravis. Best test for this condition is electromyography is best test for diagnosis of myasthenia gravis. Okay, so as you can see in this image, there is preganglionic fiber, there is postganglionic fiber. In myasthenia gravis, what happens? There is blockage of receptors present in the postganglion fibers. Acetylcholine receptors are blocked by autoimmune or anything else that results into myasthenia gravis with muscle weakness, ptosis, and if there is any problem involved in preganglionic fiber, that condition is known as Lambert-Eaton syndrome. Lambert-Eaton syndrome. So there is a difference between myasthenia gravis that you have to remember, and the difference between Lambert-Eaton syndrome and myasthenia gravis. So as you can see, in myasthenia gravis there are ocular problems like ptosis, bulbar problems like exposed bulb, and Lambert-Eaton syndrome there are no any signs and symptoms like this will be found. So this is the difference between myasthenia gravis and Lambert-Eaton syndrome. In myasthenia gravis, when postganglionic fibers are involved, smooth muscle of forehead will be affected, half of the face will be affected, eye drop and drooling of the corner of the mouth will be there. Symptom will be first noticed symptom will be weakness of the eye muscles, difficulty in swallowing, and muscle of mastication, muscles that control eyelid movement and facial muscle expression, chewing, mastication muscles will be affected, and breathing will be affected in this condition. Okay, so as you can see here in this picture, in myasthenia gravis, there is ptosis, there are axons that are involved, synapse will be involved, post synaptic membrane affected, acetylcholine receptor will be affected.